again for the next episode about healthcare. Let's welcome Dr. Chekube. So, yes, no, we did not continue our discussion last week. No, yes, last week. And I'm so sorry for not cost of customer off and off. So, continue and discuss.
Okay, I corrected you last week and I'm still going to correct you again. I am a scientist, not a doctor.
Okay, so Jesus.
Yes,
Okay, no problem. How will I put it? Is it scientist Chekube?
yes, better.
Okay, scientist Chekube, no problem. I always use that title.
Okay,
So go on.
okay, no problem. Thank you all for coming on live with us today. I am Azon Tachikubechi Ijobu, and from our last topic, we dealt with everyday habits that silently affects our health. And today we'll be continuing from where we stopped. We'll continue from where we stopped last week. And from last we looked into some of the habits and how these habits affect our heart, our brain, our hormones, our lungs, our blood pressure, and our mental health, and even our lifespan. Yeah, we checked all of these things, and we also said our body does not just break down suddenly. Rather, it whispers. Yes, it whispers before it will start to scream. In the sense that it will give you signs. You will experience symptoms. You will experience signs. After which, if care is not taken, if the underlying cause is not being treated and taken care of, the body will then break down. And then we talked about some of these habits. I'm going to list them and then we'll go over we'll start from where we stopped. We talked about habits like smoking, poor diet, excessive alcohol intake, um, lack of exercise, poor sleep, chronic stress, and screen addiction. And then from last week, we discussed only three, which are smoking, poor diet, and excessive alcohol intake. Today we'll be looking into poor sleep. We'll be looking into poor sleep. We'll be looking into chronic stress. We'll be looking at lack of exercise, and then lastly, screen addiction. Lastly, we'll be taking screen addiction. So I believe that we still remember all the things we talked about from last week. I'm just going to give a recap and then we go over with what we have for today. Okay, from last week we talked about smoking, and then we said that smoking is a very important trigger for some chronic autoimmune diseases. I use rheumatoid arthritis for example. In rheumatoid arthritis, there are some. It is a genetic disease, but then it is not all the time that this particular gene expresses itself. At times, it is dormant until when it is being triggered. And according to research, smoking is one of the very important environmental trigger of rheumatoid arthritis. In persons that have rheumatoid arthritis, it doesn't show unless it is being triggered. And then um, we also see that poor diet related to rheumatoid arthritis. There are some rheumatoid arthritis that results from smoke. The trigger could be smoking. The trigger could also be poor diet. In cases of in cases of in cases of megaloblastic anemia and rheumatoid arthritis, it results from lack of vitamin B12 intake. Yes, it results from deficiency of vitamin B12, and all these things they work hand in glove. They work together. No one can stand without the other. So that is how it is. We also talked about alcohol. If you're lost on any of these things, then you go back to our previous discussions. That was last week Friday. You're going to be clarified. So today we are going to go over lack of exercise, lack of sleep. We're going to go over stress, chronic stress, and then we're also going to talk about screen addiction. Starting with exercise, we all know that you have body, you have muscles. Muscle is these things. Yes, this is muscle. This is what we talk. This is what we call muscle, not the bone inside your flesh. All these things that cover your bones. That is what we call muscles. Yes, you have the deltoid and the rest. When you want to talk about, when you want to study it, you go into anatomy. So our body contains muscles. It is made up of muscles. It is made up of joints. A lot of things. It is made up of a lot of things. It is a system. And then these particular muscles, they are not there in your body for you to just sit down always and relax. The muscles are there for you to move them. They are there for you to move them. And then in a situation whereby you don't move these muscles, you're going to be affected. You are supposed to, just like somebody that has a car. Yes, it's a very good example. You have a car. You are supposed to use this car, and don't forget that your car has battery. This car has battery. You're supposed to use this car. Continuous use helps the car to be in good shape. It will help the battery to warm up. It will help it to be okay. In Imagine when you don't use the car for a year. Do you think the battery is still going to be the exact way it was when you bought it? That is how our body is. You're supposed to stretch your muscles. You're supposed to exercise your joints, keep them in good fit. But in a situation whereby you don't do all the things you're supposed to do, that is when you break. And then we know that one of okay, let's talk about the benefits of exercise to our body. When we do exercise, we help circulation in our body. We have circulation of oxygen, circulation of nutrients, blood circulation. Yes, we have blood flow in our body. And then we also help we help our muscles, we stretch our muscles, we help them to function properly, we help our joints, it helps us to build good posture. We also help our mental health. All these things we're talking about, they help us in one way or the other. We help our mental health when we do exercise. Exercise when we talk about circulation, it strengthens our heart. Circulation, when we talk about circulation, we talk about blood flow. Continuous exercise helps your blood to flow properly, and then it helps to make your blood vessels flexible. It will help you to reduce stroke. It reduces the risk of stroke. It reduces um it reduces heart disease. And it helps insulin to be sensitive. It helps insulin to be sensitive to glucose. And then without regular exercise, without regular activities, the cells will respond less to insulin. And then when this occurs, you know that insulin is the hormone that regulates glucose in the body. It is the hormone that regulates sugar. Let me use the term that we are conversant with. Glucose is okay, we can say glucose is sugar. Insulin is the hormone that regulates glucose. And this particular glucose, now, when it is not being regulated, you can come down with high blood sugar and also type 2 diabetes. That's one that is related to insulin resistance. And then let's take for instance, you do gym. I don't do gym. If we are to lift anything, if we are to lift weights, the person that goes gym will be more fit than I am. The person is going to be normal. The person is going to be very, very active. The person is going to be efficient in their work. But in a situation whereby you don't exercise, trust me, I don't know how you want to function. I don't know how you want to function because your heart is not going to be okay. You are at risk of developing stroke. When you don't do exercise, excessive fats, unhealthy fats, they accumulate in your body. Sugars, all these things, they accumulate in your body. And when they accumulate, they lead to one thing or other. Okay, for instance, you don't do exercise. Excessive fats, unhealthy fats, they accumulate in your body. When they accumulate in your body, you can develop hypertension. You can gain excessive weight. And don't forget that all these things we're talking about, they are unhealthy fats. And then exercise also affects your emotion. Check people that do exercise before they come out before they go about their day-to-day activities. Compare them with people that will just wake up, press their foot. Then when they are ready to come outside, they will just put on their clothes and then rush outside as if something is being done from their house. Compare their lives, that the both of them are very, very distant from each other. If you do exercise, your brain is going to function properly. Your blood flow is going to be normal, and you are going to reason well. At times, At times when I'm rushing to go out in the morning, when I'm rushing to go out in the morning, I if I don't do exercise, I tend to forget. That day, I will be very, very prone to forgetting things. But on days where I do exercises, I am very collected. I am very collected. I know how I'm doing things. I am extraordinarily careful. And then I'm cheerful. Yes, I'm extraordinarily careful and cheerful on those days that I do exercise. But on days that I don't do exercise, I just wake up and then I'm rushing to somewhere, I am usually disorganized. And then moving over, okay, do you have any question? Let me ask.
For now, I don't have any question, but I'm trying to check which question am I going to ask you. So go on.
Okay, if you have
See.
anyone, you drop it, you type it in the comments, and then I'm going to respond to it. Okay, moving over, we'll talk on sleep, how sleep affects our health. I used to hear people say that,
Okay.
are you saying something?
No, I was not saying anything.
Okay, okay. I used to hear some persons call people that sleep lazy, lazy people. People that sleep, they will just say, "Ah, this one is lazy. Forget them into they sleep." Sleeping is not laziness. It is not laziness. It is part of a biological repair. You are supposed to you're supposed to work, and at a certain point you are supposed to rest. Let's use a car for example. You have a car.
Mm-hmm.
You have all the properties that are in that car. You have your let me remember something. You have your shock. Okay, let's use shock and shock absorber. Let's use shock. You have your shock and shock absorber in your car. And then you drove this car from here to America. Do you think it is still normal? Do you think it is still okay for you to drive that car again continuously without allowing the car to rest or without taking it for servicing? It's not going to be okay.
No,
The car will break down.
it's
It
not
will
possible.
develop fault. Even the shock absorber, with time, it will stop functioning well. When you use it,
But
your
I
body
have
is
a
a
question.
machine. Okay, okay,
How many hours should someone or a human being sleep? Like how many hours? What's the duration?
okay. We have if you count from eight, it counts from 8 to 6 o'clock. 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6. That's like 11 hours. That's like 11 hours. Normally, we are supposed to sleep 6 to 8 hours a day. 6 to 8 hours.
Uh-huh.
So if you are taking 6 to 8 hours, definitely you're going to have 18 hours. You're going to have 18 hours in a day if you're sleeping 6 hours. You're going to have 18 hours in a day to work.
If
Do you
okay, if someone starts sleeping from 8 to 6, maximum time is 11 hours.
mm-hmm.
But why?
But I said you
Why?
are to sleep at least 6 to 8 hours. It is for your body to recollect. You,
The
I
mo-
use that car
but
for example. Uh-huh.
to me, to sleep 6 to 8 hours is laziness. So maximum time for someone who wants to go higher is 5 hours or 4 hours. At least in a month, you sleep at least 8 or 10 hours. Though all those times that you have not been sleeping, pack everything, sleep that day. To me, because that's what I'm doing. That's
Okay.
what I'm doing.
Okay.
So.
How I'm trying to look for a scenario that matches this particular thing you're saying, and then I'll use it to explain to you. It is just like
Okay.
it's just like um it's just like you have your shock absorber, and then
Mm-hmm.
you continue using that shock absorber every day. You bump into potholes. You don't dodge potholes. You don't dodge them. You bump into potholes. You do a lot of things, and then you know what you work for shock absorber, right?
No, I don't know what's soccer. What do you call yourself?
Shock absorber.
Okay, shock absorber.
Yes. You have
Okay,
a car,
shock
you should know.
absorber. I don't have a car.
You have it. Which one is it? I know you have a car. You should know. Okay. Do you know
I don't
shock?
have a
Do you
car.
know?
I don't even know any of these.
Oh, sorry.
Since I don't know it.
Okay. Okay. When you bump into potholes, shock absorber. If your shock absorber is still working efficiently, it is going to make you not feel it. You're not going to. It's going to prevent you from hitting your head or being it is going to prevent you from hitting your head or losing control when you are driving.
Okay.
You have pothole. You mistakenly drove into this pothole. You are sitting inside the car. You will not feel it. You will not feel the effect of driving into that pothole because you have a working shock absorber.
I've seen a car that
Uh-huh.
been on like that have been working for about 3 months and it didn't even knock down for a bit.
Okay, depending
Found
on
that
the shock absorber, depending on how good the shock absorber is, depending on how good the shock absorber is. Have you seen a battery that was not tested for 2 years, and then when you started using the battery, this battery started working normally? Have you seen something like that?
no.
That is how it is. Shock absorber, you're supposed to service it, you're supposed to change it from time to time. Why I'm saying all
Okay.
these things, we're talking about everyday habits that affect your life. Everyday habit. It is not when you just do it. It is not when you just do it now, then it will now affect you. It has to build up in within you. It has to build up in within you. It has to be continuous. You have to do it continuously for it to affect you. So that is what we are discussing
Okay.
here. You telling me that okay, you sleep for just 5 hours. 5 hours is still okay. So far you are not stressed. 5 hours is still okay. It's still okay. I can tell you now that I slept in the night. I slept from 2 to 4. It was not under the influence of anything. I was not stressed. I just was not feeling like sleeping. And then I then did some other things. And then but during the day I felt sleepy and then I just slept for like 3 hours. I've slept and I'm filled. I wasn't stressed. I wasn't pressing my phone. That wasn't the reason I didn't sleep. I just felt like not sleeping. At times you could feel like that. Your body is a biological system. At times you could feel like that. Some certain things can make you feel that way. At times you feel like sleeping. At times you don't feel like sleeping. That particular time you are supposed to sleep, but you're not sleeping. And then you do it today, you do it tomorrow, you do it next tomorrow. It continues to build up. Do you think you're okay? Okay. Let me ask you something. How
Mm-hmm.
many hours do you sleep a day?
Me?
Yes.
How many hours do I sleep a day?
Mm-hmm.
Okay, I will say from January to this moment, maximum time I use for sleeping is, let me just say, maximum 5 hours.
5 hours, okay. Okay. Five
Max.
hours is still close. I said 6 to 8 hours. 5 hours is still close. Okay, let me ask you something. Do you used to ever forget something during the day?
No,
Do you used to have mood swings?
no.
Okay. Okay. Probably your body is different, but you are to sleep 6 to 8 hours a day. You can do 6 hours, you can do 7 hours, you can do 8 hours, depending
But
on you.
I've been experiencing this mood swing and all these things that you're saying. But due to I'm used to it, I've been sleeping late every day for about, let me just say, 10 years. This is 10 years of not sleeping properly. So I've adapted to the nature of, you know. Whenever is whenever the day breaks, I'll be active, doing a lot of things, and then night before it will reach 4, I'll start feeling sleepy. I'll force myself take scarf or what do I call it? This thing. God, what is that? Fearless. I take
Fearless.
fearless just to stay active. But not always, because
Okay.
if I take it always, cause ulcer. Start doing a lot of things.
Really?
And because I always remember this quote: a man who sleeps, a man who always sleeps lumps, poverty catches him like it. So that statement alone in the Bible makes me to be, serious and like not to give up. Sometimes I'm tired. Sometimes I feel tired. I'll say, "Ah, God, when I go do this morning
You are
because
using a Bible verse. You are using a Bible verse to stop yourself from sleeping. It's not right. Though 5 hours is close to the normal time, but trust me, it's not actually right. When your body feels like to sleep, please sleep. All these things are stimulus. All these things are stimulus. All these things your body is doing, it is for it to regulate the activities going on so you don't break down. Your body will not just stimulate for you, stimulate sleeping if you're not supposed to sleep. When you sleep, it will help your body to repair some tissues that are broken down. It will help you to repair some tissues that are worn out. So you need to sleep. It helps to relax the mind. It helps to relax your brain. Trust me, if you sleep properly, you will not be forgetful. You have a very active memory. You will have a very, very active memory. Trust me, sleep helps. Sleep helps. Days that I sleep the way I'm supposed to sleep, days that I sleep, when I wake up the following day, I'm not usually in a rush. I calmly do my things. I'm not usually in a rush. I don't forget things. I calmly do my things. So I try as much as I can to get my sleep. But if I'm not feeling sleepy, fine, I'm not feeling sleepy. But I will not use something to inhibit myself from sleeping. Just like you said, you're using fearless. You are inhibiting
yeah,
sleep.
yeah,
You're inhibiting sleep.
yes,
Okay. When you
every day. Like this now, me and you, like this now that we are discussing, I'm feeling sleepy.
you see what I
I
asked
just,
you. You said no. You finally confessed. I asked you, you said no. When you don't sleep, your body will definitely stimulate sleeping. You will either sleep in the middle of something or you will be forgetting things. That is how it works. On the okay,
but
during
I
my
go check.
exam, during my exam period, I used to do TDB till daybreak at times, depending on the course. I used to do TDB. So when I do TDB, I God have mercy on me. The day I did, it was not like I did TDB, but I slept for 3 hours that particular day. I slept for 3 hours only. The following morning, I I forgot the things I read. I forgot the things I read. If I want to remember things, if I want to remember things I'm reading, what I usually do is if I read now, let me say I read for 1 hour, I will sleep for 1 hour, I will wake up, I will read that thing again. I will sleep for another hour. I will wake up. I will not forget that thing. I will not forget. I will
But the
hardly
way
forget that.
I do my own is different too. My own, even I'm feeling sleepy, first of all, two things. First of all, go and rest. Highest 30 minutes or 1 hour. Sometimes 30 minutes just for my brain to, I call it resetting, not relaxation for me. Oh. So after it, I'll go and read enough. Then 9 to 10, I'll sleep and then wake up around 12 during the exam time and then start thinking, no, 4 o'clock. About 12, I will start sleeping. I know why I slept. So that my brain will 1 hour. Go back to that book again. I'll make sure that in any exam that I want to write, even though I've not touched that book before, I'll make sure I repeat, I do repetition about 5 times, because if I do it 5 times, even though
But you
I'm
do,
feeling sleepy, but only that 5 times. I'm
but you do sleep, like during those times that you are finished rehearsing, you will sleep and then you wake up again and read it, abi?
uh
Your
I
brain
will
is
read
going to record.
that.
That is what I'm trying to tell you. Sleep helps you to be collected. It helps you to be aware of things around you. It helps your brain to be very, very active. I've tried it before. That's what I'm telling you. I asked you, do you used to feel tired? You said no. Do you used to when you don't sleep, you cannot be as active as somebody that slept well. That's all I'm trying to tell you. When you don't sleep, you cannot be
Just,
very active. When you don't sleep, is either you
just
feel
sometimes.
weak. When you don't sleep, is either you feel weak, or you have poor concentration, or your immunity is being weakened. Yes, I told you that sleeping helps in tissue repair. In a situation whereby you don't sleep properly, your tissues, the tissues in your body that are worn out, they will not be properly repaired, and then you will have weakened immunity. Your body is supposed to fight off infections. It is supposed to fight off foreign organisms. But in a situation whereby there is no tissue repair, and your immunity is weakened, your body will not be able to fight those things. That is why there are some persons that will okay, that was why there are some persons that will suffer from, okay, let me use a virus for instance. Viruses, they don't have therapy. Yes, they don't have therapy. The only thing you can treat them. The only thing you can do is just to manage the situation for some certain time. That's all you can do. And then you can also use vaccine. Yes, you can also use vaccine. You can't cure viruses, but you can use vaccine, and then you can use management strategy. This vaccine, this virus, um human papilloma virus, yes, human papilloma virus, HPV. It is a virus that comes and goes on its own. But for it to go, you have to build an immunity against it. It doesn't have cure, but it has a vaccine. But in situation whereby you did not take vaccine, you were not vaccinated for that for that particular human papilloma virus, and then you contract that particular virus. When you contract it, if your immunity is not strong, you will not be able to fight off the virus. There are some persons that will have HPV, and then within some time they will stop having it. It will just go away on its own. And then there are some persons that will have HPV, and then it will continue to be in their body. Hepatitis B virus, it doesn't have treatment, but there are some persons that will be able to fight off this virus, and then there are some persons that this particular virus will kill. So that is how it is. You just have to build your immunity. Whatever you're supposed to do for your body to be healthy, you do it. If it is sleep you need, because sleep. If you are feeling sleepy, you sleep. Even if it is for 1 hour, even if it is for 2 hours, you sleep. And then you wake up, you continue what you're doing. If you're feeling sleepy again, you sleep. But if you're working, your night time is supposed to be your sleeping time. You're supposed to sleep at least 6 to 8 hours. At least 6 hours. At least you should sleep for 6 hours so that you be active. That's just the whole essence
Normally,
of this particular interactive session.
okay, my maximum time to sleep is just 7 hours. Other days 4 hours. For sometimes three to the work I'm doing. But when I have a contract for music production, go for it. I will not sleep that day. I'll make it, do the video editing and everything. When I have a test, I don't sleep that day. I schedule everything. So I calculate myself from Monday to the 3rd, not sleep. Because Sunday, then Sunday and Friday and Saturday, I have enough sleep. Apart from Sunday, I Saturday enough because when I will definitely sleep on time to avoid sleeping. After that, I'll start preparing myself.
Okay. Okay, but I believe
Okay.
that this particular interactive section is going to help you to know how you're going to manage your sleep. It's going to help you to work on your sleep. Yes, you
I will
develop sleep
try.
hygiene. You have to develop sleep hygiene so that you'll be able to function properly. So
That,
I think okay. I'm going to continue with our discussion, and then,
well,
like I was saying,
let's end
you
it here
don't sleep.
because wait first. Let's end it here because I have a contract to attend to, a wedding contract. So I have to, meet up so that I will get my home paying. And it's starting by 4. Drummer there. I don't want to miss it because there's money there. Go, 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 go. So if not, if
Okay, so
possible,
you
we should
suggest
continue this interaction. Get the
do
point
you
now.
think do you, I think we should conclude it, then we start some other time.
Okay, so you will be coming next week Friday. Hope you will be
Yes.
available.
Yeah,
Okay,
I'll be
because
very much
Saturday.
available.
Oh,
I'll be
thank
available.
you so much. Scientist check. At least give yourself a nickname now.
Huh?
Scientist, give yourself a nickname.
I'm sorry. I'm already going by Somi.
Somi, that's
Yes,
something.
Assumpta Somi. Yes.
Azom. Yeah. Let me call you scientist. Azom. Abi scientist. Somi. Which one is better?
Okay. I think
Scientist
Assumpta is
Azom or
better.
scientist
Assumpta is better,
Azom.
or you can call me Nkemjika. Okay, Nkemjika. What about Nkemjika? It's okay.
Okay. Okay. Scientist Ekem. Is he okay?
Okay. Yeah, fine.
Oh, okay.
Yeah,
Calling him.
so we'll be continuing
Yeah.
next week. We'll be continuing
Friday
next week by
by
1 p.m.
1 p.m. Yeah.
Yeah. But
Thank you
don't
so much.
forget,
So you
you
will
need
continue the discussion. So what will be our next discussion for Friday by 1 p.m.?
yes. We'll continue from where
Next
we
discussion.
stopped. We'll continue from where we stopped.
Okay. No problem. Feeling
And don't forget
sleepless.
to
My
sleep.
God.
Don't forget to sleep. Get enough sleep. In as much as you're checking the bag, try to get enough sleep. It is very, very crucial for your health.
No problem. Thank you so much. Checking
Yeah.
them.
I'll see you
I
next
really
week
appreciate
Friday. You're
it.
welcome.
Bye.
Bye.